We find ourselves as a country 1 year into the pandemic at a tipping point. And I'm saying a tipping point because we've had 1 year to make sure that we prepare our healthcare system adequately. So 1 year down the line, in a third wave, there's an increase in the number of cases, increase in the number of mortalities. And as the healthcare workers and as the doctors of this country, we are concerned about this and the general state of laxity in adherence to the COVID-19 preventive measures. We've seen heightened political activity over the last 2 months. We're seeing that the public is no longer concerned, and this will overwhelm our healthcare system. In fact, this has been evidenced by the reports and the current situation of lack of adequate ICU units, and more importantly, the lack of adequate critical care specialists. So even as you're talking about expanding and building ICU spaces or increasing the ICU capacity, there is no adequate personnel, doctors, nurses, who work in critical care units. The rising number of infections has not spared the healthcare workers. In fact, this year, this month, is now recording a very high number of infections amongst healthcare workers and amongst our doctors. And just to say that we have 10 doctors currently admitted in various facilities across the country, battling from moderate to severe disease. And this is a big concern for us. I think we don't need to remind you that we saw what happened last year, and if currently this is the situation, then we'll be in a very difficult place in regards to the response to this pandemic. And on that note also is that the shortages in the country and in the counties are real. The infection is straining the workforce. The fact that the terms and conditions are not yet fully addressed equally is an issue of concern. The Ministry of Health last year hired 235 doctors to work in isolation and treatment centers across the country. These contracts, they were hired on contracts. The contracts expired in the month of February. And out of that number of 235, we only have 156 currently active. Most of them, the 60 or so, found better options and left the service. The contractual terms were unattractive and were not able to retain them. The delayed salaries that were paid to them. So we are at a point where our COVID situation is that we need as many doctors in the counties as possible. So this is a matter that both the Ministry of Health and National Treasury should fast track. It's an issue of funding, and the funding must be availed immediately to these doctors so they go back on the ground and offer services to the Kenyans who require these services urgently.